Welcome everybody to World Day of Regional Anesthesia and Pain Medicine. I'm Amit Pawa.
And I'm Jeff Gadsden. We are so delighted to be here to share our thoughts on artificial intelligence and regional anesthesia here with you on World Day.
Now, Jeff, this is one of our kind of podcast inspired episodes. So, am I allowed to start with a joke?
Oh, listen, time is a bit short, so let's keep the jokes on the, keep it a bit minimal if you
Well,
can.
I never miss an opportunity to get a joke in somewhere. Does
Oh,
that count?
God. No, man. Why?
Okay.
Why? Well, listen, let's move on. So, I want to talk about AI, and I
Yeah.
want to talk about the role that AI in ultrasound imaging can help us, how it can help us and stay safe, be more precise, improve quality and efficacy. The question I have what is the problem that AI is promising to help us with? Is it safety? Is it precision? Is it learning? What do you see the role of AI?
Well, I think we know from, if I think back to my early days of learning regional anesthesia, one of the things that we teach everybody is pattern recognition. You'll say you stick the probe on the neck and you're looking at interscalene brachial plexus. You want to see two ovals and a triangle over the top, and you look for the gap in between. That's the interscalene groove. You say that to somebody, but whether they can take that home with them and remember and interpret that isn't so clear. So what I think AI helps you with is pattern recognition. These advanced tools have been fed with reams and reams of data, so they will create a highlighted set of structures on the screen. So I think it helps us with pattern recognition. It's sort of, you stick the probe on, you try and make sense of what's going on, and you turn on the artificial intelligence device, and it will immediately help you identify the pattern. So I think pattern recognition is important. But the other thing it does is it helps you get to that endpoint faster. I can think of when I first started scanning, I stuck the probe on, and I took ages before I could identify structures. And when you're working in a time-pressured environment, that can be an issue, right?
Yes, absolutely. So I do think I've always said there's two main skills in regional anesthesia. One is pattern recognition and one is driving the needle. And this helps tremendously with that first one. So we see trainees come in and like you said, you'll put the probe on and it takes you a good 3 or 4 or 5 minutes to, explain this is this, this is this, this is this. Imagine if you could start with that and then paint over top and say, see, this is what the computer thinks
Yeah.
and this is where all the structures are. And what I like about a lot of these models, it's not just the nerves, it's the muscles, it's the fascia, it's the pleura, it's the vessels, those sort of things. So it really, I agree, it helps to accelerate that pattern recognition database in your mind.
And when you think about the learning curve, I think about the number of blocks I had to do before I felt that I was competent. Maybe it took me 50 attempts or 50 blocks to get good at remembering, how to do the interscalene brachial plexus block. I'm sure it probably took you the same amount, or maybe less. I don't know.
It took me 8.
Yeah.
I'm just kidding. No, it is.
Whatever. I mean, you're
but
what?
your point is well taken. I mean, it takes time
Yeah.
to build because nature throws a curveball at us once in a while, and there's the structures that are just outside the 2 standard deviations away from the norm. So you get a nerve that's over here, and a blood vessel that looks a little bit different. And what the crazy thing about this, a lot of these AI models is how sophisticated they are at determining that yes, that's a nerve that
Yeah.
doesn't live there normally, but actually is here, and it gets it correct. So it's a testament to the number of scans that have been fed into these models
Right.
and then validated by actual human beings.
I think, and again, these devices are only as good, or the software is only as good as the number of scans that have been fed into them. So I think that's a really important point. I'm also trying to think about the reality of doing a list. So if you get one of those patients who has slightly unusual anatomy, or you're at the beginning part of your learning curve and you've gone to a course, you've learned how to do something, and then you're trying to translate it into clinical practice, if you're taking 15 or 20 minutes to identify those structures or build up your confidence in identifying the structures, that can have an impact on productivity and throughput of the list. So potentially something that can reduce your cognitive workload and make you identify those key structures quicker, I think has a big advantage. And that's where I think it has a role. Pattern recognition, shortening your learning curve and increasing your productivity and the speed with which you identify nerves and fascial planes. That's where I think it's really advantageous.
I'm glad you mentioned that because I think sometimes we're at risk of putting a tool like this into the bucket of, oh, that's just for teaching environments. But I don't think so. I think this is as has universal appeal because in a busy private practice where there are no learners, you still have to identify the right structures. And if you're doing 20 blocks a day,
Yeah.
here's how I see this happening. You put the probe in the skin, you say, okay, I got a sense of where things are. Let me just confirm right before the needle goes in if I think, if what I'm thinking is correct. And I think that has a lot of merit in terms of, finding out some potential aberrant anatomy and or just confirming that, hey, you know what, I was right about that. And that gives me a bit of confidence to proceed safely with this block.
It's confidence and it's like a sense check. Yeah, I knew I was right. But also, if it shows you something that's a little bit unusual or you weren't expecting that, you should then start to apply some anatomical interpretation, some clinical judgment, and trying to say, well, does that make sense? Have I missed something or is the system wrong? We all sound very positive about artificial intelligence and regional anesthesia, but clearly there must be some risks. Do you see any risks with this particular technology? Because I'm nervous about some things. What are you nervous about?
I think the biggest risk is that I'm going to be furloughed and sent home to relax while this
So
some
you're
computer does
worried
my
that
job
you
for me.
might lose a job?
No, I think it's a tool. I think it will help me do my job even better than I was doing before. So, but in terms of risks, I think the biggest risk that is quoted about this is that it's a crutch, and it's something that if left unchecked
Yeah.
and not done in a thoughtful way, intentional way, maybe a learner could get through his or her training and be reliant on the computer interpretation rather than use it as a confirmation. Do you know what I'm saying?
I do. And I think if you've only ever learnt regional anesthesia and then had this extra tool there to support you, and then you suddenly go somewhere where it isn't there, you might feel uncomfortable. But do you know, does that remind you of anything? I'm trying to remember when ultrasound was first introduced for placing central lines, right? Do you remember those guys are like, oh, it's not very good to use ultrasound because then you'll forget the old ways. I wonder in regional anesthesia whether artificial intelligence we're going to be saying the same thing about that. If in 20 years time we've got a system that doesn't have artificial intelligence, we'll be thinking, oh, we're doing something wrong. At the moment we're nervous and we're scared about change, so anything that's different or new makes us feel a little bit on edge. But I wonder whether in a few years time it will be essential to have some of this stuff integrated. I don't know. So I think over reliance on a tool and then suddenly finding you're somewhere where it's not there makes me worried, and I think that's a risk. What about if it labels the stuff incorrectly? Because at the end of the day, um, it's only as good as the data it's fed. What happens if the AI labels something incorrectly? What do we do then? Because that's something, if somebody blindly follows that tool, that makes me feel a bit nervous. So is that a risk?
I think so, and that's why we need to use this intentionally and thoughtfully. So when we're implementing this into our workflow, the idea is you're still going to be an expert. We're still going to teach you how to do these procedures as if the AI wasn't there, but
Yeah.
it's an additional augmentation of your interpretation. So the AI is not going to replace experience, but what it can do is it can compress that journey from zero to competence, right? So and allowing you to do things safer, quicker. And let's face it, there are now what 40, 50 different blocks that
Maybe even more. Maybe even
that
more.
an expert needs to know how
Yeah.
to do. So if it takes you, half the amount of time to do an interscaling brachial plexus block, that other time can be spent learning the next block.
I think you're right. But I can't stress enough how artificial intelligence should not replace us having a basic anatomical understanding of the areas that we're scanning. I think that's probably my biggest fear. So, number one, wrong data. Number two, over reliance on it. But basically, people don't bother to learn. So they stick the probe on. They say it's going to tell me where to go, and then you've got blind faith. So you have to remain skeptical. You have to have anatomical knowledge. You're going to say something smart. Go on.
And I rarely say something smart, but what I was going to say was, I think actually the tool can be used to highlight and reinforce that need for critical thinking. So you put the probe on, you see what you see, you make an interpretation, then you turn on the AI, and there will be times when those two interpretations don't match.
Yeah.
So I think that will and should prompt a clinician to say, okay, I really do always need to use my own clinical judgment in these situations. So, so I think it, rather than being a crutch that you just rely on blind 100%, this is always right.
Yeah.
I think it'll reinforce the need for comparing, and why did it think that was correct when I didn't think so, or vice versa.
Yeah, absolutely. I think there are a few different systems that are available out there, and there are some that are standalone machines that you have to plug and play into different systems. You get two screens, and there are other systems where the artificial intelligence is integrated into the machine. So one of those is the NeuroBlock software that is integrated into some GE Venue systems. Have you used it? What do you think about it?
Yeah, it's amazing. I mean, that's one of the big advantages, is it's baked into the system itself. So you don't need another whole box or a computer or cable, and oh, the battery's dead, so I got to plug it in, sort of thing. So what's brilliant about it is you get your image you like, then you flick a switch, and up comes the painting on over top of the nerves and the vessels and that sort of thing. So you can turn it on, turn it off, which I think is really critical in terms of using that as the tool in the way that it's meant to be used. Not always on, not always off, but able to flick, 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 flick back and forth.
I'll tell you, one of the things I do like about the system, which I think we talked about in some of our other podcast episodes, is you get a quality meter when you're doing the scan. So it gives you an indication of how closely the image that you've generated matches what it says in his logbook. So you kind of, if it's looking like it's not a great image, it will spur you on to try and improve the image. So I think that's quite useful.
Yeah,
and I think you've already.
I'm still waiting for that. I'm still waiting for that voice activation feature where it's like, move that probe 2 centimeters to the right, sort of thing.
Who knows? That may be coming soon. I want to know whose voice they're going to use for that, though.
Obviously, a robot.
Yeah. But the other thing, I think you've stressed it once already, and I think it's really important to say again, if you are going to use these tools to help support your decision making, it's important that you don't have the artificial intelligence on whilst you're doing the block, because then it obscures a lot of the image that you're looking at. So you want to basically have put the ultrasound on, make an assessment of what you think the things are, turn on the AI to confirm what you think is the case, and then turn it off while you're doing the block. You don't want to have the AI stuff on while you're doing the block. But I think there are a lot of potential roles where it can be a benefit. So we've talked about high turnover lists, but what about a senior consultant who's gone to a workshop and is late to learning regional anesthesia? They've gone to a workshop, they were a bit embarrassed because there were lots of younger people there. They've got some skills, and then they want to start doing their first block, their first femoral nerve block, or their first tap block. There may not always be somebody they can ask to cross-reference or to corroborate. So they apply some of that knowledge. That's where it has a role.
I agree. This is a very common scenario. So we teach workshops around the country, and 90% of the people that attend them are over 50.
Yeah.
The people that didn't get to learn ultrasound as a resident, they've had their job for 20 years, but guess what? Now there's a new surgeon that wants blocks, and the hospital is saying you have to learn this, and so this is their mandate. And so the challenge there is, I could teach them all they want for those 2 days at a workshop, but then they go home and suddenly Jeff or Amit's not there over their shoulder. Wouldn't it be great to have this little confirmation that this helps build that confidence? And I think this is a really great use case, which is why I always say, like, I've had people say to me, oh, the AI stuff, that's just for novices, just for beginning learners. I disagree completely. I think there's a lot of role for this, no matter what stage of your career you are at, because it can provide that little confidence boost, especially if you're busy, tired, fatigued, overworked, distracted by lots of other things going on. Putting that image on right before the needle goes in, huge
It's
potential.
in a similar manner to the way that we would often say, well, let's put the color Doppler on before we needle this area to make sure there are no aberrant vessels. This is doing this is adding that extra interpretation. So I think it definitely has. I don't think it definitely has a role. But also one of the problems we have in the UK as well is that the level of regional anesthesia training we have across the country isn't uniform. So you might work in one geographical area where there are lots of regional anesthesia enthusiasts, and then you might move to another area where there aren't. And that might put some initial learners off putting or performing regional anesthesia if they haven't got somebody else there to help them. So I think it's quite nice. It takes some education out into the community. So I don't know. I wonder in a few years' time whether you might, in the same way that we're skeptical when ultrasound came out for central venous access, when it comes to AI and regional anesthesia, I wonder whether we might think, hey, you're not doing things properly if you haven't got something there to help you out as a
Yeah,
cross reference. I don't know. It's something to think
I,
about.
I I wouldn't be surprised. I mean, there's a lot of work to be done out there for sure.
Absolutely. But it's important. We just got to emphasize again. You still have to, as a clinician, you turn it off and you've got to interpret and look at the data, look at the information you're getting, and say, does that make sense? You just don't blindly follow it, because this is like a GPS. So you know the direction you need to go. You're pretty sure, but you're just going to cross-reference with this and make sure it's highlighting the areas that you think. But you've got to then you interpret the information you're given sensibly as well.
Yeah, it's not to carry on with your analogy. It's not self-driving car. It's you're not sitting there with your hands behind your head and your eyes closed. It's GPS. It's guiding you, and the AI is confident even when it's wrong. So we need to maintain that skepticism and build our own libraries of what an image should look like in all these anatomical variations.
Absolutely. And listen, Jeff, I mean, AI is not going anywhere, isn't it? I think the future with regional anesthesia definitely is going to include some kind of intelligence, but maybe it's not just artificial intelligence, maybe it's augmented intelligence.
I think you're right. Well, it's been a great chatting with you about AI, and I hope you guys at home really enjoyed our thoughts. If you want to hear more about our thoughts on artificial intelligence or nerve blocks or anything, you can always join us at
www.blockitlikeitshot.com.
or scan the QR code.
Guys, I hope you have a fantastic rest of your World Day. Happy World Day. Enjoy the rest
Happy
of your
World Day.
meetings wherever you are. Take care. Bye bye.